Irritable bowel syndrome, or IBS, affects the large intestine. Symptoms include abdominal pain, bloating, and changes in bowel habits. These can be diarrhea, constipation, or both. IBS is chronic, but symptoms can vary. It doesn't damage intestines but affects quality of life. Causes include abnormal intestinal contractions and gut bacteria imbalances. Stress and certain foods can worsen symptoms. Diagnosis is based on symptoms and medical history. Management includes lifestyle changes, diet, and sometimes medication. Recent research has shed light on the complex nature of IBS, leading to a better understanding of its causes and potential treatments. One area of focus is the role of the gut-brain axis, the intricate communication system between the gut and the brain. Studies have shown that people with IBS may have a heightened sensitivity to sensations in their gut, which can amplify pain signals sent to the brain. Emerging evidence suggests that eosinophils, a type of white blood cell, may play a role in the gut-brain interaction disorders often associated with IBS. This research could lead to new targeted therapies aimed at modulating eosinophil activity to alleviate symptoms. Additionally, scientists are investigating the potential of fecal microbiota transplantation, or FMT, as a treatment option. FMT involves transferring fecal matter from a healthy donor to a recipient's gut, with the goal of restoring a healthy balance of gut bacteria. Furthermore, there is growing recognition of the importance of integrating mental health care into IBS management. Studies have consistently shown that psychological therapies, such as cognitive behavioral therapy, or CBT, and mindfulness-based stress reduction, or MBSR, can effectively reduce IBS symptoms and improve quality of life. These therapies help individuals identify and modify negative thought patterns and behaviors that may contribute to their symptoms. Diet plays a crucial role in managing IBS symptoms, as certain foods can trigger or exacerbate digestive distress. The low FODMAP diet has gained significant popularity as an effective dietary approach for IBS. FODMAPs are a group of short-chain carbohydrates that are poorly absorbed in the small intestine, leading to fermentation in the colon and triggering IBS symptoms in susceptible individuals. The low FODMAP diet involves restricting high FODMAP foods such as onions, garlic, wheat, and dairy products for a period of time to assess their impact on symptoms. After an initial elimination phase, foods are gradually reintroduced to identify individual triggers and personalize the diet. While the low FODMAP diet can be highly effective, it can be challenging to follow long-term and requires careful guidance from a registered dietitian. Recent research has also highlighted the potential benefits of carbohydrate-reduced diets for some individuals with IBS. Studies suggest that reducing overall sugar and starch intake can be as effective as a low FODMAP diet in relieving symptoms for certain people. This finding is particularly relevant given the emerging evidence that genetic variations in carbohydrate-active enzymes, or HCAzymes, can influence individual responses to carbohydrate-reduced diets. The field of IBS treatment is constantly evolving, with new medications and therapies emerging to address the diverse needs of patients. One promising area of research focuses on developing innovative oral peptide therapeutics for chronic abdominal pain. These novel medications target specific pain receptors in the gut, offering a non-opioid alternative for pain management. Another groundbreaking development is the investigation of fecal microbiota transplantation, or FMT, as a potential treatment for IBS. FMT involves transplanting fecal matter from a healthy donor to a recipient's gut, with the aim of restoring a healthy balance of gut bacteria. Clinical trials are currently underway to evaluate the efficacy and safety of FMT for IBS, and preliminary results have shown promise in alleviating symptoms for some patients. Furthermore, scientists are exploring the potential of oxytocin-based oral painkillers for chronic abdominal pain. Oxytocin, a hormone known for its role in social bonding and stress reduction, also has analgesic properties. This research could lead to a new class of pain medications that address both the physical and emotional aspects of IBS. In this section, we will explore the American Gastroenterological Association's guidelines for the treatment of IBS. The AGA provides evidence-based guidelines for the diagnosis and management of IBS, offering healthcare providers a framework for providing optimal care. The AGA guidelines are separated for IBS with diarrhea, known as IBS-D, and IBS with constipation, known as IBS-C, recognizing the distinct needs of each subtype. For IBS-D, the AGA recommends rifaximin, an antibiotic that targets gut bacteria, as a first-line treatment option. Additionally, aloxatilin, a medication that regulates bowel movements, is a new addition to the guidelines and may be considered for patients who do not respond to or cannot tolerate rifaximin. For IBS-C, the AGA recommends a combination of lifestyle modifications such as increasing fiber intake and engaging in regular physical activity, along with medication. Medications recommended for IBS-C include fiber supplements, osmotic laxatives, and medications that specifically target constipation, such as linaclotide and plecanatide. As research into IBS progresses, it is becoming increasingly clear that a one-size-fits-all approach to treatment is not always effective. Personalized medicine, which tailors treatment plans to an individual's unique characteristics, is gaining traction in the field of IBS. One area where personalization holds great promise is in dietary management. Studies have shown that genetic variations in carbohydrate-active enzymes, which play a crucial role in digesting carbohydrates, can influence how individuals with IBS respond to low-carbohydrate diets. Those with defective enzyme variants may benefit more from carbohydrate-reduced diets, as they may have difficulty breaking down certain carbohydrates, leading to IBS symptoms. This discovery paves the way for personalized dietary treatments based on genetic markers. In the future, healthcare providers may use genetic testing to identify individuals who are more likely to benefit from specific dietary interventions. This personalized approach could significantly improve treatment outcomes and enhance the quality of life for individuals with IBS. Integrative medicine, which combines conventional medical treatments with evidence-based complementary and alternative therapies, is gaining recognition as a valuable approach for managing IBS. Integrative treatment plans for IBS typically encompass a holistic assessment of an individual's gut health, diet, stress levels, and lifestyle factors. Elimination diets such as the low FODMAP diet and gluten-free diet can help identify trigger foods and alleviate symptoms. Probiotics, which are live bacteria that can improve gut health, may also be beneficial for some individuals with IBS. Behavioral therapy, such as cognitive behavioral therapy and mindfulness-based stress reduction, can help manage stress and its impact on the gut. Additionally, stress reduction techniques such as yoga, meditation, and deep breathing exercises can help regulate the gut-brain axis and reduce IBS symptoms. Acupuncture, an ancient Chinese practice that involves inserting thin needles into specific points on the body, has also shown promise in relieving IBS symptoms. The relationship between mental health and IBS is complex and bidirectional, meaning each can influence the other. Stress, anxiety, and depression can worsen IBS symptoms, and conversely, living with the chronic discomfort of IBS can take a toll on mental well-being. Recognizing and addressing the mental health aspects of IBS is crucial for effective management. Behavioral therapies, such as cognitive behavioral therapy and mindfulness-based stress reduction, have consistently demonstrated efficacy in reducing IBS symptoms and improving quality of life. Cognitive behavioral therapy helps individuals identify and modify negative thought patterns and behaviors that may contribute to their symptoms, while mindfulness-based stress reduction teaches mindfulness techniques to manage stress and reduce anxiety. In addition to therapy, lifestyle modifications such as regular exercise, adequate sleep, and stress reduction techniques like yoga and meditation can play a significant role in improving both mental and digestive health. Support groups and online forums can also provide valuable emotional support and practical advice for individuals living with IBS. Irritable bowel syndrome is a complex and often challenging condition that requires a multifaceted approach to management. The latest research highlights the importance of understanding the interplay between the gut, the brain, and the individual's unique genetic makeup. While there is no one-size-fits-all cure for IBS, a combination of lifestyle modifications, dietary changes, medication, and mental health support can effectively manage symptoms and improve quality of life. Consulting with healthcare professionals specializing in IBS, such as gastroenterologists, registered dietitians, and mental health therapists, is essential for receiving personalized guidance and developing an effective treatment plan. Staying informed about the latest research and treatment options empowers individuals to take an active role in managing their condition. With the right approach, people with IBS can live full and meaningful lives.